Gouet, hello. Thanks for joining this session. You've joined the Federal Veteran Homelessness Programs and Policy session. In this session, you're going to learn about existing, new, and recommended federal government programs and policies for ending veteran homelessness in Canada. My name is Marie Morrison. I work with the Canadian Alliance to End Homelessness with Built for Zero. I'm also the veteran lead for the communities that we're working with who are working to end veteran homelessness. And we are very honored to have this session in Halifax, Jibuktuk, situated on Ki Miigwegi, the ancestral and territorial and traditional lands of the Mi'kmaq people. So thank you for joining the session. It is being recorded. It is simultaneous interpretation, if you want to make that connection. Let me introduce the speakers and the presenters that will be in this session. First, we have Veteran Affairs Canada, Homelessness Response, and the speaker is Christine Mallon. She'll just give a little wave. She's the manager, Homelessness Partnerships with VAC's Intergovernmental Programs Division, which has the policy lead on homelessness. She will be joined by her colleagues Angela and Alyssa, you'll see down at the end. And they will be here to help answer questions. So in this session, you're going to gain a better understanding of the services and supports that VAC currently provides, what the department is currently doing to address veteran homelessness, and be better equipped to help veterans navigate VAC programs and services that can help veterans experiencing or at risk of homelessness. The second presentation is from Infrastructure Canada's Simon Todd. I'll just get him to give a wave on the new veteran homelessness program. So again, participants are going to learn about the objectives of this program, the different funding streams, eligible activities, expenses, and next steps of program implementation. And the third presentation is from Sandrine Deforges from the Max Bell School of Public Policy. After being tasked by the Federal Housing Advocate to identify federal policy recommendations to address veteran homelessness and ensure adequate right to housing for veterans, their team conducted a review of the existing academic and gray literature and interviews with 30 plus interest holders. And their presentation will discuss key insights from the research process and propose policy recommendations at the national level. So I'll welcome Christine to come up and give her presentation.
Thanks. Good afternoon, everyone. Veteran well-being is a priority for Veterans Affairs Canada, and every veteran deserves a safe and affordable place to call home. The issue of veteran homelessness is also a priority for the Government of Canada. There have been commitments made from speeches from the throne, mandate letters, and commitments in federal budgets in both 2021 and 2022. In today's presentation about the VAC response, I'm going to talk a little bit about the veteran population overall and what we know about those experiencing homelessness, the supports that are available through Veterans Affairs Canada, gaps that have been identified, and what we're working on to improve. So for the first time since 1971, the 2021 census provided an opportunity for individuals to identify themselves as veterans, and over 460,000 of them did. Prior to the census, VAC had estimated the number of veterans to be over 600,000. While this number seems high when compared to the census, not all veterans self-identify, so the actual number may be higher than reflected. The census was also able to provide some excellent information on the demographics of veterans in Canada, such as 1.5% of the total population of veterans over the age of 17 were veterans. They make up almost 1/3 of the core working group at ages 25 to 54. Over 4 in 10 are 65 and older. Nearly 1 in 6 are women, and nearly 1/4 live alone. It is important to remember that the census is a household survey. It may have captured some hidden homelessness, such as veterans staying with family members, but it would not have identified our demographic of homeless veterans. So there's many different estimates on the size of the veteran population who experience homelessness. However, the only actual data we have comes from point-in-time counts and shelter studies provided to us by Infrastructure Canada. Based on these counts, we estimate about 2,600 veterans are currently experiencing homelessness in Canada. Of those 2,600, they are most likely to be men, and the average age is 48, which is older than non-veterans experiencing homelessness at 38. There is also usually a 10-year gap between release and homelessness. Veterans also share many of the same contributing factors as other Canadians who experience homelessness, such as physical and mental health issues, substance-related issues, including interactions with the justice system, domestic violence, unemployment and unstable employment, and marital and family breakdown. Veterans also cite additional factors of military-related trauma and difficulty transitioning from military to civilian life. In order to help with the transition experience, VAC maintains a strong relationship with the Canadian Armed Forces to enhance our transition services. Together, we offer a variety of services to help veterans prepare for transition, including risk assessments on releasing members, transition checklists, seminars on VAC programs and services, coordination with military family resource centers across the country who can assist veterans and their families. We also have VAC staff that work on site at transition centers. VAC's transition services team works closely with CAF on activities to enhance transition supports. We are looking at options for SCAN seminars, end of career counseling earlier, also developing an exit strategy earlier in a member's career, and enhancing services like having a warm transfer for those who are releasing due to medical reasons, to name a few. The 32 transition centers also provide mentor coaching and support to members who are going through transition. Transition isn't just a single point in time, it is a process, and the support provided throughout that process is always being enhanced with the goal of making transition seamless for all transitioning members. Once an individual has transitioned out of the military, VAC has many resources available to support veterans. One thing to keep in mind is that these benefits are not specifically designed for veterans experiencing homelessness. That said, the supports listed here are some of the VAC benefits that can be used to support veterans who are experiencing or at risk of homelessness. These include mental and physical health benefits, such as supports and services related to physical and mental health, such as case management, mental and physical health and wellness, financial programs and services, supports for helping make ends meet, emergency funding, such as disability benefits, income support, medical costs, and emergency funds, including the Veterans Emergency Fund. Education and jobs, preparing for post-service life, training and education, and finding a job, such as career transition services and the education and training benefit. Housing and home life, which is getting help at home, assistance with at-risk housing situations, death and bereavement such as counseling services, and the Veterans Independence Program. We also have benefits for families and caregivers, including the Caregiver Recognition Benefit and the Veterans Independence Program for survivors. We also have the Veteran and Family Wellbeing Fund, which provides grants and contributions to public, private, and academic organizations to conduct research and implement initiatives or projects that support the well-being of veterans and their families. Each of VAC's benefits has its own eligibility criteria outlined in the authorizing legislation. For most of these benefits, eligibility is not tied to the definition of a veteran that is noted on VAC's website. An important note to remember is that all veterans can apply for VAC services and benefits. They don't have to be an existing client. Veterans can approach the department for support at any time during their service, even years after. I have also included some links in the resources section of the presentation that can provide more specific information, including eligibility requirements for the various benefits that we offer. In addition to providing services and benefits directly to veterans, VAC works with homeless serving organizations to increase the awareness of VAC services and benefits and to encourage an identification and referral of veterans by using existing VAC supports. Some of these activities include outreach to local shelters and homelessness organizations, encouraging the inclusion of a veteran identifier in screening and intake process, presentations on VAC benefits and services to targeted groups and organizations, collaboration with local organizations in supporting identification of homeless veterans and provision of services, including working with initiatives like the Military Veteran Wellness Program, a partnership with police services to identify and refer veterans in crisis. We also provide materials that organizations can post, so veterans who are accessing these organizations can see what services and benefits we have to offer. In working with these organizations, we have heard lots about what we are doing and what we could be doing better. We have used this information to inform our analysis of the gaps in VAC programming in the context of homelessness. Through analysis, we have found that while VAC has partnered with Infrastructure Canada on the Veteran Homelessness Program, there is currently no existing VAC homelessness programming, no benefits or services specifically designed to assist veterans experiencing or at risk of homelessness. Supports provided to veterans are often parts of other benefit programs that were not designed with the flexibility and responsiveness needed to address challenges faced by these vulnerable veterans. We also know that applying for VAC benefits can be challenging to veterans, especially those experiencing homelessness. Engagement with partners has told us that we need to have supports that are easy to access and more immediate. Each VAC program also has its own eligibility criteria based on the authorizing legislation. For example, many benefits can be accessed only by those who have a service-related disability. This means that some veterans may not be eligible to receive the same benefits as others. As mentioned on the last slide, VAC collaborates with many organizations across the country who provide support to veterans experiencing homelessness. Some of these organizations have told us that VAC needs a way to provide ongoing funding so they can continue their work. While the well-being of veterans has always been a priority for Veterans Affairs Canada, our department previously did not have a team dedicated to the issue of veteran homelessness. To address this, we created the Intergovernmental Programs Division, which has a team whose sole focus is on homelessness. The division leads departmental initiatives and activities related to collaboration between multiple levels of government and coordinates with local government and community-level organizations on various issues, particularly those aimed at preventing, reducing, and eliminating veteran homelessness. VAC's Intergovernmental Programs Division continues to work on community and relationship building with organizations who are already working in this field across the country, which includes developing new partnerships and strengthening existing partnerships within the homelessness sector, researching provincial and territorial benefits and local programs that could support veterans experiencing homelessness, engaging with colleagues in the veteran and homelessness communities, as well as internal VAC colleagues and other government partners to gain a clear understanding of the homeless veteran population and their needs and challenges. Developing a more coordinated approach to veteran homelessness, partnering with Infrastructure Canada on the Veteran Homelessness Program, and continuing to collaborate with Canada Mortgage and Housing Corporation on ways to increase available housing for veterans. In closing, we know that veterans will continue to face challenges that could impact their ability to maintain stable housing. We know homelessness will always be an ongoing issue that requires unique solutions for each veteran. We also know that not all veterans experiencing homelessness will choose to change their living arrangement, and it is important to respect a veteran's choice and provide the supports as needed. That said, we are optimistic that efforts underway at VAC and Infrastructure Canada will go a long way in reaching our goal of ending chronic homelessness among veterans. I also have this is just my email, and also Kendra Bonjokian, who's our project director, if you have any questions or ever want to reach out at any time.
So, yes, big hand. Thanks very much, Christine. So we're going to save the questions to the end. But all of these presentations are also being uploaded on the site, so you can have them. And Christine has also provided this presentation in French. I will now turn it over to Simon Todd.
Thank you so much. Good afternoon. It's nice to be with you today. Still trying to figure out if I want glasses on or off. I'm at that point in my life where it's pretty clear that I need bifocals, so bear with me. Okay. So I'm here to talk to you about the Veteran Homelessness Program. VHP is a standalone initiative. It's part of the Government of Canada's National Housing Strategy, and our program is modeled after the United States HUD-VASH program. That program takes a housing-first approach and combines rental assistance through the Department of Housing and Urban Development with case management and clinical services through the Department of Veterans Affairs. And the idea is that HUD-VASH moves people who are experiencing homelessness rapidly from the streets or from emergency shelters into stable and long-term housing with medical and social service supports. And VHP builds on the Reaching Home approach as well, and it's intended to leverage an existing partnerships and INFC relationships with community service providers. Now, in terms of veterans, how they're seen in Canada, they're typically recognized as a federal population, but housing and homelessness are, of course, shared responsibilities between the federal government, provinces and territories, and municipalities. INFC is the federal lead on housing and homelessness policy, but VHP uses what's commonly referred to as a whole-of-government approach. What we've done as INFC has partnered with VAC and the CMHC to design and implement the program. They've been involved with us from day one in putting the program together and implementing it. So what we do is we leverage VAC's expertise in relationships with veteran-serving organizations and with veterans themselves, and we also leverage CMHC's housing policy expertise. In terms of program design, we have a funding envelope that totals $79.1 million in funding over 5 years, and the program is delivered through 2 streams. We have the services and support stream and the capacity building stream. Services and support stream is $72.9 million with rent supplements and wraparound supports services such as counseling and substance abuse treatment. For our most recent call for proposals, the maximum funding request for this stream was $6.5 million per recipient. There's also the capacity building stream, which provides $6.2 million in funding for research and improved data collection. It's also intended to help increase the capacity of organizations to deliver targeted initiatives to serve veterans and understand the challenges that they're facing and tailor their services towards them. The maximum funding request under that stream was $1.5 million per recipient. Now, in terms of the program design, for the purposes of our program, veterans are considered former members of the Canadian Armed Forces and the Royal Canadian Mounted Police, either one. In terms of eligible recipients, the program has been designed with as much flexibility as we can give to get different types of groups funding. So not-for-profit organizations, veteran-serving organizations, municipalities, Indigenous organizations, as well as public health research organizations and educational institutions. As well, eligible recipients include provincial and territorial governments and their entities, including departments, agencies, and crown corporations. In terms of how they deliver the services, there's 2 options. Program recipients can provide their services directly to vets, or they can flow funding to other organizations. Most programs typically do it one way or the other. We have the flexibility in our program where they can partner with INFC directly and provide services, or they can get funding from INFC and then flow that funding, as I say, to a third-party service delivery organization. Whatever works best for their project design. So for our 2 streams, services and support and capacity building stream, I'll go through the services and support stream first. The program, this stream provides rent supplements, which bridge the gap between what an individual can afford to pay for their housing and the actual cost of housing. The program is designed to allow for housing choice among veterans, as the rent supplements are portable and they can be combined with other supports, so whether they're municipal or provincial funding, and as well they are not linked to a particular housing unit or housing a building. So if a veteran is moving to a different living situation, that rent supplement can go with them. And so this expands the existing services to support veterans experiencing or at risk of homelessness with wraparound services as well, such as general health and medical services, including counseling and substance use support, or something like life skills, including budgeting or job interview training. The idea is to provide those wraparound supports to help veterans get into a more stable housing situation and maintain that stable housing situation. The second part of the program design is the capacity building stream. So we understand that veteran population is not homogenous. It includes Indigenous people, women, and as well the LGBTQ2S community. And all of these groups may require tailored approaches. So what we've done with the capacity building stream is to support research on veteran homelessness. An example of this could be a research project interviewing veterans who have lived experience with homelessness or at risk of experiencing homelessness to understand the barriers and challenges to their success in terms of retaining or maintaining stable housing. The other part of the capacity building stream is that the building capacity part in the veteran homelessness serving sector. An example of this could be a pilot project to develop partnerships within a region to develop innovative housing solutions for veterans experiencing or at risk of homelessness, or also developing and facilitating training across a region to, again, to meet the needs of veterans who are facing homelessness. Our call for proposals was launched in April, just the end of April 2023. We had a national call for proposals that was originally scheduled to run 8 weeks. It was later expanded to 10 weeks because we had some organizations who asked for a little bit more time to put the proposal together. And the call for proposals attracted significant interest from across the country. We had, I believe, 4 applicant support webinars, 2 in English, 2 in French, and by the time they were finished, I think we had close to 100 participants overall. INFC is currently reviewing the applications. Funding determinations are expected to be communicated very shortly. And the expectation is that the ministry will be making project announcements. It's anticipated for early 2024. So that's a brief overview of the program. I'll turn it over to our McGill colleagues and happy to answer questions later.
Good afternoon, everyone. It's really a pleasure to be able to be here and hear from everyone and the other sessions as well. I feel like extremely grateful, but also to be able to talk with you today. My name is Sandrine Desforges. I use she, her pronouns. I just graduated from the Master of Public Policy at the Max Bell School of Public Policy, McGill. And as part of our program, we conducted a research and policy project that focused on veteran homelessness. So I'm here to discuss with you the findings and the policy recommendations that emerged from that project. Before everything else, I do acknowledge that we have some veterans in the room, and I want to thank you for your service. It's an honor to be able to present this project to you. So without further ado, the agenda for this session today, I'm going to start representing the context of the research project. I say we because we were a team of 4, so if you hear that slip into my vocabulary, that's why. And the methodology of our project. And then I'm going to present the key findings of the policy recommendations as well. So 3 learning objectives: better understand the risk factors of homelessness for veterans, identify gaps in existing solutions. As we've heard, there are many, many solutions and projects that exist, but we still face the issue that there are still some thousands of veterans experiencing homelessness. So what are the gaps? And identify policy recommendations. So, as I mentioned, as part of the Master of Public Policy at Max Bell School of Public Policy, we are paired with a real-life organization to tackle a policy challenge. And my team, with Taylor Chase, Alison Clément, and Anmol Gupta, we had the pleasure of being paired with the Federal Housing Advocate's Office and tasked with the policy question that you see on the screen. So what federal policies and programs are needed to ensure meaningful reductions in veteran homelessness and advance the right to housing for all veterans across Canada? So we conducted a 4-steps project. The first step is, of course, to conduct an extensive academic and grey literature review. So we looked at thousands of resources, including government websites, legislation. We also looked into jurisdictions within Canada, but also in the US, in the UK, in Australia, South Africa, Finland, and looked at academic papers as well. Of course, there are 3 main documentation that we refer to often, which are the National Housing Strategy, the 2019 Standing Committee on Veterans Affairs report on veteran homelessness, and the 2022 Auditor General report on chronic homelessness. After this literature review, we met with 32 organizations to really get a better understanding of what's happening on the ground. What are the challenges that are being faced? What remains, what is lacking with respect to accessing available services? And we met with tons of different types of organizations, as you can see on the screen. The third step was sitting down and assessing all that information and drafting the key findings that we presented to a federal housing advocate. And the final and most important step was to build the policy recommendations that I can't wait to present to you. I want to acknowledge a couple of constraints before moving forward. So it is an academic work, which means that we had 8 months to conduct all that, a very limited time period for such a complex issue. So there are some angles that we couldn't dive as deep as we would have wanted, and we also didn't have any funding. But the main issue, of course, of our project is for ethical reasons. We couldn't interact directly with people experiencing homelessness, so we know that that's a limitation, and we recommended a federal housing advocate to bridge that gap by conducing that, by engaging with people with lived experience directly. But we did have the ability to meet with tons of organizations who had people within themselves that had lived experience, so that was super enriching as well. All right, key findings. I talk fast because I have a lot of things to say. We got to 8 key findings, and the first one is probably the one that is the most important one that has the ripple effect of the rest, which is the fact that there remains a lack of clear federal leadership on the issue. And I am aware, I'm saying this sitting next to Infrastructure and Veterans Affairs Canada. They already are aware of what I'm presenting, so I don't think it's any surprise to them. But the thing is, there are many actors involved in the field. Infrastructure, Veterans Affairs, Armed Forces, CMHC. But they all focus on specific elements. For instance, infrastructure as the NHS, they take care of data collection, but they're not specifically expert on veterans issues. Veterans Affairs is the other end. They have the expertise on the realities of veterans, but as they mentioned themselves earlier, they didn't have the homelessness file under their account until very recently. And housing is not necessarily always considered as part of their mandate. So this lack of clear leadership has had really important repercussions, especially with terms of accountability. When you look at the reports, the annual reports and the quarterly reports from the National Housing Strategy, even though veterans are one of the priority groups identified in the strategy, there is no reporting on the progress made since 2017. So we have no idea how these numbers changed over the years, if there was any progress at all. And that leads me to my second point, which is that there are significant discrepancies in the reported numbers of veterans experiencing homelessness. Earlier in this session, we talked about approximately 2,600 people that are veterans that are experiencing homelessness. When we did our interviews with many interest holders and stakeholders, we heard various numbers ranging up to more than 10,000 veterans experiencing homelessness. And that is because the data collection tools, although they do some sort of job at acknowledging the numbers, they have some gaps. For instance, they are mostly focusing on gathering data from shelters, food banks. These are places with which veterans seldom interact. They tend to experience more hidden homelessness. They tend to not necessarily always go to these resources because of many reasons, but also the fact that they're not military culturally competent, which I'm going to talk to you a little later. So these data are always lacking some information. And if we don't know the magnitude of the issue, how can we address it properly? We also heard something that we didn't expect from our consultation, which is the fact that the Veterans Affairs definition of a veteran, we all know that there are that are multiple definitions of who is a veteran, but the Veterans Affairs definition, which is that someone must have completed basic training and must be honorably discharged, left out people that might be even more at risk of experiencing homelessness. If someone, for instance, was released during training because they got injured or ill, or if ever they were not honorably discharged for whatever reason, and we can recall that historically some of the reasons was simply bisexual orientation that some people were being released during the LGBT purge, so some reasons are not always legitimate. This can hinder people's ability to access services and benefits that are available to veterans. As we mentioned, I think Alan mentioned that in the presentation this morning, but there's also many reasons why veterans are sometimes reluctant to self-identify as veterans. Sometimes it's because they don't recognize themselves as veterans. Sometimes it's because embarrassment or pride, or also because of negative experiences in the military. They don't really want to have anything to do with it. But this also hinders their ability to access services and benefits. When we met with women-specific groups and gender-diverse specific groups, such as Rainbow Veterans or the Women Veterans Research and Engagement Network, we really learned that available services often do not meet the needs of women and gender diverse individuals. For instance, shelters often don't allow for dependents, and shelters are really binary. So if you don't identify as male or female, where do you go? There's also the fact that women are at higher risks of experiencing sexual assault within the military, and they're not always feeling safe among veteran-specific spaces. So how can we make sure to meet these needs? Another key finding was the fact that some individuals entering the armed forces have pre-existing risk factors for homelessness, and that is something that emerged from studies in the US, that the all-volunteer force sometimes had people with risk factors that were not addressed during the military, and once they got released, at increased risk of experiencing homelessness, such as lower education, weaker family unit, that were not being addressed while in the military. Canadian Armed Forces and VAC, as much as they've done a lot of efforts in the past couple of years, and there's a lot of improvement that happened, and they mentioned all the things that are being provided during transition, there still remain some gaps. When we did our interviews with organizations, they mentioned 4 key areas in which transition was insufficiently supported. The first one being that although tons of services are available, and it's not necessarily that the services are not the right ones, but there are a disconnect between available services and who is accessing the services. Sometimes veterans are not aware of the existing services. Sometimes it's complicated to access them. So that's the first sphere. Another sphere is challenges reintegrating the workforce, challenges transitioning between health systems, and also just the lack of financial literacy that some veterans have getting out of the military that they don't get trained on during the military as well. And then finally, as was mentioned earlier, some veteran-serving organizations that do amazing work to build housing for veterans face challenges themselves in getting funding and accessing lands to be able to build these veteran housing projects. So, tons of issues. What do we do with that? Our team sat down and we built a series, I think, of 12 or 13 recommendations. I won't go on all of them in depth today, but our report, and I have a QR code at the end of the presentation if you want to read it all. I hope you do. We separated them in 5 key buckets of recommendations. We have 2 foundational buckets of policy recommendations and 3 core policy recommendations. So I'm going to dive into these buckets, not all the specific recommendations. But I want to say before getting into the recommendations that we did try as much as possible to follow and to incorporate a human rights-based approach. So, of course, right to housing should be upheld for everyone, and the right to housing is a human rights-based approach as specific principles that I think most of you are aware of. So you'll see that in our recommendations, we try to uphold the right to self-determination, to include participatory mechanisms, to ensure accountability and reporting mechanisms, and so on. How this is incorporated in the recommendations is much more elaborated on in the report. So the first set of recommendation is with respect to primary leadership. As I mentioned earlier, there's still some unclear leadership and responsibility on the issue. So what we recommend, looking at everything that was available, we believe that Veterans Affairs is the best suited to have that primary leadership, and they're already doing tons of progress on doing that. We identified 3 areas where we think they could consolidate this leadership. The first one is by making sure that the mandate that they have include, written in text, housing security. For now, when we met with the different stakeholders, sometimes it wasn't clear if it was falling under their purview or not, because the mandate states that they're in charge of the care, treatment, and rehabilitation of veterans into civilian life. But what's the extent of that? It's not always clear. We also recommend Veterans Affairs to shift from a reactive approach to service delivery to a more preventative approach to service delivery. So currently, a veteran has to opt into Veterans Affairs and create a VAC client, I don't like the term, but client account, to access services and benefits. Many won't do it for many reasons, either the complexity of the system, either they're not aware of it, either they have negative feelings towards VAC, which happens, which also lead them to not do it. And currently, there are more than 300,000 veterans that are not registered with Veterans Affairs, and that hinders their ability to access services. Of course, not all veterans will potentially need services and benefits, so it's not necessarily an issue for these 300,000. But the thing is, as we mentioned earlier, a veteran that experiences homelessness tends to experience it 8 to 10 years after being released. And it's not once you experience homelessness that you have the resources to then register to VAC. We also hope that being registered will enable to provide preventative services along the way so that maybe you can prevent someone from experiencing homelessness altogether. And then there's also the recommendation of creating another advisory council within VAC. So there already are some advisory councils on mental health, transition, and we think one on homelessness with people with lived experience would be a great recommendation. The second set of recommendations is with respect to the data issue that I mentioned before. So we know that with the Reaching Home strategy, some organizations can get some funding to implement HIFIS and HMIS systems, which is great. They're not perfect, but it's a step in the right direction. However, the homelessness serving organizations that often have HIFIS or HMIS, like food banks, shelters, as I mentioned earlier, are not the services and places that veterans tend to go to the most. What we recommend is for VAC to proactively connect the Reaching Home strategy with veteran-serving organizations such as the Legion, such as Veterans House, Honor House, Home for Heroes, so that these organizations that interact directly with veterans implement these systems as well, and can contribute to data collection. We also think that some of the questions of these systems could be improved. Right now, in the list of mandatory questions, there's only one question that asks if someone is a veteran. But that doesn't tell us anything about their rank, the number of years they served, and that is really important information to maybe be able to draw some trends between service and who is experiencing homelessness. And we also recommend, I was talking about the Veterans Affairs definition earlier, that the VA ombudsperson conducts a systemic review on the impacts of this definition on access to services and benefits. Okay, I'm moving into the core sets of policy recommendations. In terms of housing support, as I was talking about VAC taking a more leadership role, another recommendation we think they could do, but that's a little bit of a bigger one, is for them to create a position of housing specialists within VAC. It would be different from case managers, but they would collaborate closely with the case managers so that if a case manager identifies someone with housing precarity, they could direct them to the housing specialist that would have a great expert knowledge of the local housing solutions available to them and the housing partners within the community. This initiative was directly inspired by the Mission Old Brewery and the TAMI system we saw this morning for those that were at the conference. And then there's also, again, a great service offered by VAC, which is the Veteran Emergency Fund, but we've heard by talking with organizations that veterans are not always aware of the existence of this program, or sometimes there are some delays in accessing it. So if it is dispersed into the veteran-serving organizations so they can more easily distribute it to veterans, we think that would make the service available more accessible. I'm almost done with the recommendations. I know we have a lot. So in terms of the housing supply, of course, as was said in the minister's keynote speech earlier, if we don't increase the supply, we're never going to fix this issue, and we recognize that. So we have two recommendations that target that. The first one is with respect to improving the federal lands initiative. So again, it was mentioned this morning that in the current state of the federal lands initiative, it's not really useful for veterans organizations to access lands. What we recommend is for the FLI to parcel smaller bits of lands that would serve the needs of veteran-serving organizations, and it would be way more accessible with limited funds, and also to have a veteran-specific stream of the FLI. We also think that, for instance, old military bases that are now becoming divested land could be prioritized to serve for veterans' housing project. It would be a great way to commemorate their service as well. And then we've seen in many mandate letters the promise of having specific streams of the Rapid Housing Initiative or the National Housing Co-Investment Fund of CMHC for veterans. We have yet to see that happen, so our report also pushes in that direction. And last but not the least, we know that some of the root causes of homelessness for veterans are mental health issues, substance use, trauma, and more. However, when we're talking with veteran-serving organizations, many mention that it is really discouraging for a veteran to seek help because often when they meet with a mental health professional or any other types of health professional, they are faced with someone who don't understand their reality, don't understand their language, and this affects the efficiency of the care. Sometimes it will lead the veteran to just stop getting care altogether, and that's problematic for many reasons. I think we all know that.
there are existing services to build military cultural competency, so the understanding of what a veteran has gone through. These training exists. For instance, there is Warrior Health, which is a training that's super relevant in this scenario. But we recommend for these trainings to be scaled up and to be offered, for instance, to all organizations working in the homelessness sector that might interact with veterans, with more clinicians around the country as well, so that people can appropriately meet the needs of veterans. And finally, it was mentioned that a lot of things is happening to improve transition, and that's true. Since 2019 especially, Canada has really implemented tons of new things to improve transition, such as the My Transition app, the transition checklist, a dedicated transition period for transition. But when we compare to what is being done in the US and the UK and Australia, there seems to be amazing things that could be implemented here that's not being done. So we recommended a 6-step transition process that I'm not going to run you through all now, but I just want to bring your attention to a couple of things. The first thing is during service, there's already some transition curriculum happening, and we think this could be improved by implementing courses on housing, for instance, description on the rental private market or how to access community housing or stuff like that. And also courses on financial literacy to fill that gap that was identified earlier. During 1 or 2 years prior to release, what is done in the US is that there is some pre-release counseling with individualized case managers that can make sure to really help the veteran or the soon-to-be veteran find housing, re-engage with the community where it's going to live after being released. Make sure that they're aware of existing VAC benefits, that they register with them, and create that VAC client account. So we think this could be really useful. And another thing I want to mention is after release. Once the veteran is being released, what do we do with that person to make sure that they're always connected with Veterans Affairs, that they're always receiving preventative care so that later down the line they don't fall into homelessness? So that was a lot of information. In the 1 minute that I have left, what can you do as people working in that sphere? Well, the first thing is know that all these recommendations were addressed to the Federal Housing Advocate, and it's now in their hand to decide if they want to bring these recommendations to the relevant ministers and bodies. So we hope that this advocacy will happen, but it's also advocacy work that you can all do on your end. But also, as organizations, if you do recognize that maybe you don't have military cultural competency amongst yourself, you can decide to go get that training, to go get that knowledge that could help better serve the needs of veterans. Also recognizing that the veteran group is not a homogeneous group. Women veterans, Indigenous veterans faced very, very different issues. So being aware of that and getting that information, working with specific groups to address those needs is also important. Implementing the HIFIS or HMIS systems, if you don't have them already, to help fill the data gaps as well. So I'm done talking. If you want to read the full report, which is way more comprehensive than what I just did, you got the QR code right here, full report executive summary. And I'm also available to answer any questions. My contact information is on the next slide, but I'm going to leave that up if you want to take the QR code. Thank you.
Wonderful, thank you. I want to just have everyone give a big round of applause for all 3 of our wonderful presenters. So I was partly responsible for helping to put together the veteran stream of programs and wanted to pair all of these folks up because I thought it would be really interesting. Before we sort of turn it out to questions at the audience, I wanted to ask Christine and Simon if you had any thoughts, things that you thought resonated with you from Sandrine's presentation, things that you're like, oh, there's maybe some other information I would like to share. So I just wanted to start with both of you before we turn it out to the audience.
Go ahead.
It was a great presentation, and I think, I definitely agree with, earlier, with some more transition supports, especially earlier in the career. I think that I definitely agree with that, and yeah, other than that, I think that's really my main thing.
I'll speak just to the data collection piece if I can, just because it's whenever you're designing public policy and programming, you always want to be able to quantify the need as best you can so you can marshal your resources and get the funding, get the help to the people who need it. And The challenge we have with veteran populations is similar to that of other types of homeless populations. We don't have exact numbers. We have estimates, and those numbers shift from year to year, and so we're working on a bit of a moving target, trying to figure out how many veterans are out there and where they're at. And so in designing the program, data collection is something that has been integrated into the design of the program. We've integrated it into the way the services and support stream will work, in that funding recipients will be conducting data collection, and we will be taking that data collection back and trying to implement the program in a way that's based on what that data tells us. The other part of it too is the capacity building stream provides funding for that type of, it can provide funding for that type of research to get better numbers, to get more solid information, to help inform federal programming.
That's great. Thank you. All right, if you have questions, I'm just going to ask for interpretation, and for the recording, if you could come up to the microphone, and our friendly ambassador will help with that. Oh, we're passing it around. Wonderful.
Just in response, my name's Tara. I'm in infrastructure, and we are responsible for the delivery of homelessness programming, including the delivery of the programming for veterans' homelessness. So as was mentioned in the presentation earlier, we're still we've done the assessments of the applications, and we're hoping that by early 2024 we'll be able to make announcements on that. But just to flag that, I think that will be the intention in terms of, one of your points was around, knowing where to get service, right? And I think, the Reaching Home program deals with community entities for homelessness. When we do have projects for the Veterans Homelessness Program, we'll make sure that those organizations are quite aware of who gets funded for the Veterans Homelessness Program. And I think there is an opportunity to sort of bring the players together so that veterans know where to go at all levels. And we work really closely with CMHC and VAC in this program, so it'll be an opportunity to ensure some of the key players are aligned. Just wanted to share.
Thanks, Tara. Great, and I appreciated you sharing your name and where you're from, and that's helpful.
Hi there. I actually have two questions. I'm from Veterans Affairs. I'm one of the FNSO, so Field Nursing Service Officers. So I do deal with veterans homelessness on a fairly regular basis, but I do have two questions that maybe you guys could clarify, just for my knowledge here. The first one would be for Christine. Is there a possibility when we do have homeless veterans that come through our doors to reach out to you guys directly for any assistance? And is there anything, I know you guys had talked about the VEF, like the Veterans Emergency Fund. What I've heard from veterans is it's very hard to get the funding, and it's a very lengthy process. Is there work being done to kind of streamline that? That's my first question.
Sure. Yeah, you can feel free to reach out to us anytime. We'll do everything we can to help you out. Okay. In regards to the Veterans Emergency Fund, I was actually looking into that because I had the same type of questions. It's in a different area than us. I used to work on the Veteran and Family Wellbeing Fund, so I'm more familiar with that piece. But with the Veterans Emergency Fund, I was told that it can be fairly quickly. As far as I know, there's no additional work to streamline it, but I was told between 2 to 4 business days at the most. But again, it depends on if you have all the correct information. I know that the Veterans Emergency Fund can provide, if a veteran came, this is the other thing, if they came during work hours and they needed a place to stay, somebody could use their card and get the veteran a hotel room for that night, and then we can get them lined up with services. But that's as much as I can answer about the Veterans Emergency Fund. But again, feel free to send me an email, and I can get some more information for you.
I'll send you a message separate.
That sounds great.
Yeah. And then the next one is for Simon, because you had mentioned about our RCMP members, right? Our former RCMP members. And as you know, for Veterans Affairs, eligibility and services that can be provided to RCMP members are different than our traditional veterans, right? So for homelessness, is there different types of services or different eligibility, or if an former RCMP member comes to us, can we provide the same type of services?
Well, the idea is that any service provider that's getting funding through VHP, they can extend their services to a former member of the CAF or the RCMP. It's open to participants for the program can be either one, so they're eligible to receive rent supplements, or they're able to receive whatever counseling or wraparound supports they need. That's the way it works. Is that good?
I just want to also say that I have had conversations with case managers who have been able to get the Veterans Emergency Fund like same day or within 24 hours. Okay. So it depends on what the situation is. Like, is it the rent that needs to be paid, or is somebody experiencing homelessness that needs to be housed right away? So it depends. And also service verification and how quickly that can be done.
Okay, perfect.
Right over here.
Hi there, thanks. My name is Amber, and I'm with the Legion Foundation, BC Yukon. Thanks so much for the policy research. I could have really used that when I filled out the infrastructure grant and did a deep dive into many of those surveys and the rest. So I know a lot of the veteran-serving organizations that I've run into here rely really heavily on that peer-to-peer support, right? Just about every organization, that seems to be a real key factor in success, right? As somebody who's walked that journey, has done that. Any ideas or plans or supports available? I'm starting to see burnout among the peers that are supporting their peers, right? From a Legion standpoint, each Legion branch has service officers in really high traffic areas. Those people are burning out, and they're stepping back and they're saying, for my own mental health, I can't do this anymore. So any thoughts around that? Any, you know what I mean? Like we almost need to help the helpers in some cases. And I haven't seen anything, heard anything, wondering if anyone on the panel has.
Thank you. I could speak without the mic, but I know it's for the virtual. Not directly answering your question, but an alternative we have considered with our team is one of the reasons why there is so much burnout, and that is within the peer-to-peer, but also from what we've heard, and please correct me if I'm wrong, but also within the case managers at VAC. And that is because there's not enough people, and the burden is too high, and each person has too many cases to deal with really complex issues. So my answer would be more funding to hire more people and train them and support them and increase working conditions. And I hope that it would also have a ripple effect of alleviating the burden on that peer-to-peer support if there's more institutional support as well.
So simple, but so true. Yeah, thanks.
Thank you for that question.
There was one thing I just also wanted to flag, because before I think I panicked and totally lost all my thoughts. But when we were discussing, when you asked your first question, Marie, I just also wanted to bring up the definition of a veteran that is noted on our website. So that is there. It's how we technically define a veteran, but it's not used for eligibility for our programs. So it's not going to impact a person's or a veteran's decision, what will happen for their decision for their application for benefits or services. So I just wanted to note that. And also, while I definitely agree with more work I think needs to be done in transition, because that is a really critical time, we are constantly evolving, constantly. So anyways, I just wanted to flag that. Thanks.
I also just want to say, just so, because I know people in this room support veterans and support them after transition, the Canadian Family Military Resource does have financial counseling available. So that's part of the transition process, is that they have a program to help. I just didn't want people to walk away thinking that there was nothing available. Sorry.
Good afternoon, everyone. My name is Eric Larose. I'm the community manager of the RCMP Community Policing Unit in Moncton, New Brunswick. I see a lot of your presentation related to a mid and long-term solution, but if I can share with you what we're living in the street of Moncton with veterans is lack of short-term support for our veterans. So as you know, when the RCMP gets called, when any police officer is getting a call for any event, it's because everything else failed. So most of the time, we have two options, the hospital under the Mental Health Act or under the criminal code for either a breach of peace or any other criminal offense, which end up in these cells, most of the time with no charge the morning after when the person is stable. So I don't know if a program exists for short-term solution, like a place where we can bring that veteran for that night, the hotel paid and stuff like that. That's what we need. I'm going to tell you, that's what we need in Kodiak or probably many municipalities, where we can have a short-term solution where that person's got the minimum service and doesn't have to go either to hospital or a cell. Thank you. And great presentation, by the way.
I know it was maybe more comment than a question, but if you haven't talked with them, I would recommend you talk with the City of London, Ontario, which maybe the numbers are different, so that might help as well. But they do have something like that with dedicated, I think it's hotel rooms and other places that they can put veterans that they do find that day. I don't know all the details of how that works, but if it's something that maybe could be exported elsewhere, that could be an idea. Maybe someone in the back has
Is it federally funded or is that municipal?
From my understanding, there is a bit of funding from the Reaching Home strategy.
Okay, which city again, sorry?
City of London.
So I will say, we're going over to Jose, who, this is great. People are meeting. This is why we have conferences. We're networking. But also our folks at the front may have some further comments. But
So I'm glad you mentioned it because I'm the veteran lead in Moncton, which I was going to reach out to the RCMP to do a little presentation and create a partnership. My question, though, because your answer, yes, we can put them in a hotel. You just have to call me. Like they said, Veterans Affairs is very sufficient. Like 24 hours, sometimes it's even the same day. Like it's very fast, depending on the situation, the urgency. My question, though, because I've done that before, put them in hotel, and then the next day the hotel calls with $60,000 damage. So, like, my question is for the ones that are not, like, some of them will be fine put in a hotel, so we can create an emergency plan and then put them in shelter or whatever it requires. But is the ones that are not well, what do you have recommendations? Because, like, even me calling Veterans Affairs, like, if they hear voices, if they're in psychosis, like, it's really hard to connect veterans to services and put emergency stuff in place because it might not work out, right? So what do you do in those cases?
Yeah, sure. You go ahead, Amina.
I don't know if you've been here this morning for the presentation, the action table that we created in Montreal. So we've been facing those situations on a regular basis. I'm here with Dwayne. He works in a shelter at Les Maisons du Père. So I would say there's no ideal, there's no magical solution to that, of course. You know that. So it's really important to work in close collaboration. So you can ask for case managers' help. They can assist. They're there for that. But also, like if the individual is hearing voices, I think we refer him to the hospital. Okay, of course, that's the first thing. And then you need to plan with your partners the next step. Because you can put him in a hotel for one night. But with a veteran emergency fund, if you put him for one night, it cannot last a month. So you need a plan B. Right. Because then we are not targeting what a veteran emergency fund is for. So it's just like a short-term solution. And when you do that, you need to have a plan B. Because you cannot pay for a month, 2 months, 3 months, and if it's winter time, what do you do? So I think what we do is we try to find, and Morgan this morning illustrated situation that we work really together. So I think it's the partners that you have that can make the difference. And then it's different for every veteran. It's different for every situation, mental health or whatever the problems he has. And then, try to work it out. Do you want to add something?
Well, just to add, it all, like Amina said, it all depends on the situation and what's going on. I know it's not everywhere, but in Montreal we have a team, Urgence Psychosociale Justice, which is a team of social workers that will come evaluate somebody that's in a psychotic situation and be able to refer to the right and make sure that they get into the right services. So it's for sure somebody that's going through a psychotic break. We won't put them in a hotel, but we'll find the hospital, the crisis center, the whatever services are available for the person. And like Amina says too, it's always what's the plan B afterwards, because even if they're in the hospital, if they're in the crisis center, we have to set things up for the after. So that's where the network comes in to help find, okay, what's the best adapted services for the veteran for the after.
I do also just want to say that I like with these solutions like hospital, police services, there is still a big gap that needs to be addressed for temporary housing. Like if somebody's not having psychosis but is not safe, does not feel safe to go to emergency shelters, then where do they go? You know, like, and I guess we put them up in a hotel, but there is a big gap of lack of transitional houses. Like from what I've heard from people working in the field.
Other questions? Yes.
So for Simon, just a quick follow-up on the VHP. So you mentioned the announcement in early 2024. Do you have a feeling for when cash would flow, though? Is it new fiscal year you're expecting?
Yeah. It's really difficult to put an exact timeline. I know people are anxious to hear.
Yeah, for planning purposes, right? Yeah.
Yeah. Yeah, no, I can't really speak with any more specificity to it. The expectation is project announcements will be made early 2024. As to when that funding flows, it's depending on a lot of factors. It depends on the negotiation between the department and the successful applicants as to when that contribution agreement is finalized and the funding is able to flow.
Okay.
And it will be case specific as well, too.
Okay. And I know you're in the middle of doing the reviews right now, but for next steps, is there any thought for making this an ongoing, enduring program as opposed to a one and done?
I don't have any information on that at this time.
Because if you could, that'd be great, right?
If I were in a position to speak to it, I would, but unfortunately I can't.
Okay, thank you.
Thanks for that question. Yeah, currently a 5-year program. We have a question up here or a comment, Ryan?
Yeah, it's a question. Like, case manager at back, this is like my hypothetical situation, right? And so I have a mic now. So the report said it recommended more directed financial benefits targeting specifically homelessness with VAC. And VAC does have financial benefits that veterans are eligible for. But are we looking as an organization to retool some benefits specifically for veterans' homelessness?
That's something that we're exploring. It's not necessarily a set in stone thing, but we're definitely like discussing all sorts of different solutions and hope to discuss it in the national committee as well, which you can let us know what you think.
I have an idea. Anyway,
Perfect.
Also, the Veterans Emergency Fund can be paid directly to community support providers. It's just only done by check, so there are delays from Kirkland Lake.
Other comments, questions, reflections?
My name is Brian Hilson. I'm a veteran. And I'd like to just kind of speak to how the veterans think, because that's the biggest problem. And the biggest problem is going from the military to civilian, because there's a 6-month gap where no money comes in. And I went through this, and I've used the Veterans Relief Fund. I've gone through everything. I've almost gone homeless. I've got PTSD, went to Afghanistan twice. And that's the biggest problem right there, is the transition period. And then afterwards, it's the case managers can't handle the anger that comes from the veterans. It's the anger. The anger is what triggers all of the, what's the word I'm looking for? The empathetic people. And then it just draws them down. And then there's such, like, this big circle and this big void that happens. And then the veterans have to re-explain their story 100 times. And every time they re-explain their story, they get angry. And then every time they get angry, they go into the shell. And then that's why you guys can't find any of them, because they refuse to speak to you guys. Because nobody understands, especially the combat ones. I can't speak to the other ones because there's a whole bunch of different cases. But I think getting on top of the mental health of the veteran before he gets out. It's almost like I feel you shouldn't release him from the military until you're 100% sure that he can take care of himself, or he or she or they, them, whatever they are, right? And I think that that's the biggest problem right there, is getting the veteran to admit, or not even admit, but just be stable. Because I know when I got out, I had money coming in from all different places, and nobody told me where my taxes were going, or what percentage of tax I had to take off which one. So I'm $18,000 in fucking debt, sorry for swearing, to the Canadian government as a veteran who served my country. So I have the tax revenue people all over me right now. I'm still like $10,000 in debt because I wasn't explained properly how all the money works out. And that's the other part that happens. It's the financial burden. It's not even that we don't get enough money. It says you're giving a whole bunch of money, especially the big lump sums of money to people. That's the other problem, is giving veterans a big lump sum of money. You cannot give mental health, or people struggling with mental health, alcohol, drug addictions, big chunks of money like that, and then them not buy a house or something. And that's a lot of where the other issues are going, is nobody's watching what the veterans are doing with their money and how their money is being spent, along with their mental health. And I think those are the two biggest things right there. If you guys can get a grip of what happens to the money that veterans get, or at least train them better, and if they can't be trained because they're not there, keep them in the military longer so that they can get those thoughts back under control, because it's anger, guys. Yeah. Like, we have so much anger inside of us that we just don't know what to do with it. And as a veteran of 2RCR, none of my buddies are homeless because they all killed themselves. Or they're on the verge of doing it, or they're sitting in their house just alcoholics right now. And that's the problem. They're all sitting at home just stewing with anger, because it feels like you guys are trying, but it feels like you guys don't care. And that's what it feels like to us, because it's such a runaround, and it's such a circle, and it's just such a pain in the ass to get anything done at all. And it has a lot to do with the high transition rate of these poor empathetic people, and a lot of them are women. And they try so hard, but they just don't, you guys, I'm sorry, they just don't understand what it's like to be a soldier. And that's the biggest thing right there, is, like, I went through so many psychologists and I stopped talking to them because none of them could help me, because they're too used to dealing with, you know, people like housewives with mental, what's that term? I don't even know. But you know what I mean? Like, just people who just aren't dealing with anger and combat. And we're trying to help them the same way that we help people that aren't going through that. And I think more of a diversity in the way that we treat people, because I know in Fredericton we have a bunch of different services that aren't offered across the country, and it's the only reason I'm able to speak to you guys the way that I am, or else I'd be still standing in the back just listening to you guys talk. But we have this thing called neurofeedback in Fredericton, and it's nowhere else in the country. And that's where we have to start with the veterans while they're still in the military, get them into that type of therapy, because talk therapy doesn't work. So if you guys have any more questions for me, I could go on forever. I'll be around all week, but thank you for letting me share. And you guys are doing a great job, but it's the anger, and that's what you got to get through.
Brian, thank you for your service, and thank you for sharing that and being willing to share that with everyone. That was really, really powerful. I wonder if anyone has any reflections or thoughts on what Brian shared.
I also just want to say thank you for your service, and I'm sorry for your losses.
Yeah.
I hear that all the time. And to me, that's what I find, that there is a disconnect. There's a lack of when you guys release. I find that that's what I meant. Like there's a lot of paperwork and there's lots of things that are thrown at you and you don't know, they can't, like, it's too much. And I hear, like, I speak to veterans on a daily basis, and it's heartbreaking because we want to help, right? And I think there has to be some more research or more things that need to be done to see what can we do, right? Where's the disconnect and what can we do to help?
Thank you. Jose, did you still have a comment? You had your hand up, and we'll just get you to wait for the microphone there.
I just want to say, like, he couldn't have explained it better, like, nailed it completely. As soon as you call Veterans Affairs, the little recording while you're waiting, if you're angry, if there's foul language, all these things, we will not help you. And that's right from the start. As I'm calling with a veteran, he hears this, you can see his face already red. Yeah.
It's just like, when I get on the phone, it could be just with a bill company that I'm behind on a lot of bills too as well. And like, I could just be talking and all of a sudden, just for no reason, I just start yelling at them. And then I have to calm down and explain to them it's not their fault. And then I have to tell them that it's the corporation they work for because they just don't care about people. And then that carries over to the government as well, which is just as bad or even worse. Right? Because we all see what the government is doing to us right now. Right? We're not even addressing that fact. We're talking about all the things that we can do through the government, but we're not talking about what we can do to get the government to change. And all they're doing is just giving us more taxes now. More taxes. I can't even afford to eat anymore. I'm going to be homeless here soon too. Right? And that's because we're on a fixed income, that's the reality we're facing now. And prices are just going up on everything.
And see, like what he just said, that's a daily thing for me. Doors close and close and close because it's not just with Veterans Affairs. It's as simple as I need to make a dentist appointment. Well, we can make an appointment in 2 months. Boom, the explosion. You know what? We're not taking you for a client. Then I have to coach and coach and coach to the point where it's like, you know what? I don't want to talk anymore. You do everything for me because I don't know how to react anymore. That's such a troubling thing to deal with every day. Another comment I'm just going to say from my observation that would be really helpful. A lot of veterans are not techie. When you sign up for a Veterans Affairs, a VAC file, you need to do this online most of the time. The amount of veterans that don't even have an email address because they're like, I don't like computers, it's not me. That alone is a huge barrier. The person on the phone, a simple thing as, you know what, you want me to create you an email? Do you want me to help you? And actually, that's what I do. I sit down. But for the communities that don't have a community lead to actually do the things, that's a huge barrier. It's like, no, go online, do all these things, because even correspondence, you don't have a phone, that's no problem. You can go on the VAC account, you can chat with your case manager, but if you don't have the technology or the wisdom of how to do that, right there, you're all by yourself all over again.
Yeah, a lot of guys are even older than I am, and they grew up before computers, and even in the military, they stayed away from the computers. And then when they got out, they're just like, nope, and they just wash their hands of it and walk away. Because it's easier for us to just keep our mouths shut because we've been trained. That's the other problem. The Canadian government did such a good job of beating us over the head with a stick to keep our mouths shut. And then on the other time, or the other factor, the combat arms especially, you're told from the chain of command down, if you go to the MIR, you're a waste of gear, and you should just get out. You guys don't know that. But every day there's veterans that are told, you go because you're fucking sick, you're useless, get out of my forces. That happens inside the military.
Thank you. I'm seeing a gentleman hand up here.
My name is Charles Chopin, and I do volunteer work with veterans. We talked about more research. We researched the veterans to death right now, and I know the veterans are wanting more resources, more access to resources. I had this discussion earlier that, we make this assumption that everybody has computers or has access to the internet. In the area I live in, it's rural. We have, we still have dial-up internet in some parts, and the veterans don't, they really can't get to a computer because, like Brian said, they don't know how to use a computer. They just want to talk to somebody on the phone or drop into the office. Our office was closed. Yeah. Our office was closed for COVID, and it's still, I think it's being staffed all week, but the staff is not there to meet all the veterans. So it's just that type of consideration has to be given to the veterans.
Thank you.
And I am a former vet.
I'm seeing a comment up here.
I just had a question of what.
Oh, and just for the translators and for the folks online, and do you want to go first, and then we'll go over there? Yeah.
Thank you very much for telling us that. I mean, it reflects a little bit like the reality that we're facing. I myself am a case manager at Veterans Affairs Canada. This morning we were presenting about homeless veterans. And the anger you're facing, I would say like most of my veterans are were in the infantry, so tough guys. So the anger, it's something that I deal with on a daily basis with them. And I've been advocating a little bit about the computer and my VAC account because I know it's difficult for the guys in the infantry, right? The paperwork, it's not their thing. But I would just like to let you know that Veterans Affairs offices are open. And you can schedule, well, I don't know if for the other regions, but I know for the... Okay, well, in the office of Montreal, the offices are open. Veterans can take an appointment with case managers, and we can help you out with those papers. I've done it many, many times as well. Yeah, and as well, you were talking about the coffee. We are able to move, and we can come and meet you in a Tim Horton. If you don't want us to come at your place, we can meet in a public place. There's issues about the confidentiality as well. It has to be discussed with the veteran, but these options are there. And I would just like to let everybody know that case managers know as well what are you facing and are really trying hard. And don't hesitate to come and ask for the services. And it can be done in person, it can be done by Teams, and not only by my VAC account, because we know that not everybody has access to it.
The office in Oromoto is reopening. Finally.
Yeah, I think I saw that the other day as I
Yeah.
was by it. I kind of threw that as a part up there because it was closed for like 6 months.
Well, no, it's been closed since the beginning of COVID. So it's been closed. Is it reopened now?
I think the official reopening.
That's great.
No quote me might change, but
Everything changed with the government. We all know this,
supposed to be yesterday.
except for the one money.
I was just wondering, because I'm not from the military or anything, I just with a charity that helps veterans helping veterans. So we actually help people fill out the paperwork. But I was wondering, what is the issue of not being able to get the information from the Canadian Armed Forces once someone is discharged from the Armed Forces, to just having all that information transition to Veterans Affairs? Like that should be like that would happen in the business world. Like, why is that not? That happens when you turn 65. OAS kicks in and CPP. Like, that information is available in the database. Why is that just not being transitioned so easily from one agency to the other? It's not like rocket science.
It's because the military just started acknowledging mental illness as a real thing.
Yeah.
Not that long ago, we used to call it aluminum hot soup.
I can't specifically answer this question, but I agree. It would make life a lot easier. I believe it's because we're bound. I think it's a privacy issue, but Ryan might have more insight. But to my knowledge, I believe we're bound by privacy.
Yeah, so VAC doesn't administrate the service health records. It's like a delay on the CAF end of things, but that doesn't justify it. But now transition centers are releasing veterans sufficient copies of their service health records when they release, like paper copies, that they can take with them. They're doing it in Edmonton right now.
Hi, just quickly. In my 24 years of service and many years of being retired, that information from DND to VAC with the service number and all the service details, it always just took a day or two. Is that not the case?
Yeah,
verification of service,
verify,
two or
yes,
3
it does.
days?
Yeah. Yep,
Okay, so it
that's
still
right.
does. Okay.
Yeah.
Just wanted to be clear. Thank you.
But I think the question that just happened was why doesn't VAC just know about this accident that happened 10 years ago? Why don't we just have those records? Am I right? Yeah. Yeah, the medical records, so that we can start administering their benefits immediately.
There are still delays in service verification if it's a new file that's with us, but it might be 4 years back, so they have to go to actual paper records. But for the overall service verification, it's pretty fast. You know that. So.
Was there another comment you were? No. Okay.
If I can add quickly something about that. So yes, there's all this, but there's also some benefits, and that was mentioned a bit by Christine, I think, earlier. But for some services, you need to prove that it's service related. But sometimes the injury or the illness will not be manifested during service. Sometimes it will come later down the line, but will be associated with the military service. But then you need to find a proof by a health professional or mental health professional that it is related to service to have access to the benefit. And in some jurisdictions, it's easier than others, but some professionals are hesitant to confirm that it's related to service if it's been a couple of years afterwards. So even if VAC, they want to provide the service, but they lack the evidence, and then the professional is not providing the evidence. So, how can we also make it easier, bureaucratic-wise, for veterans to access services?
Yeah. Could someone help me out? What time is it right now? 10 after 5. So we have 5 more minutes, and then we wrap up.
Just to comment on that, and this is a recent development within the last year with our new mental health benefit. It's upon application within 24 hours, you can get approved for treatment benefits. Right? So that situation is improving. I'll say it again.
Ryan, I'm going to get you to repeat it.
Yeah, I'll say it again. So VAC now has the new mental health benefit, which is upon application for a mental health issue, mental health problem, usually within 24 hours, they will get temporary coverage for 2 years for treatment regarding that benefit before even a decision is made by VAC while you gather evidence. So there is some coverage. There are improvements being made. I appreciate you keep coming back here, man.
Right. Okay, not seeing any more questions. I want to very much thank all of you for attending and thank you for sharing and telling your stories and answering each other's questions and the reflection. That felt like just really rich, and I hope that it was helpful to everyone in the room. And I want to really thank our speakers again for taking the time to prepare presentations and being up here, and thank you to everyone. Give them a hand. I want to also thank our translators, our tech folks, and our ambassador who was helping out today. And to just remind you that there is a welcome reception happening back in the room where lunch and the plenaries were being held. There will be food, and you have a drink ticket on the back of your name tag, and we hope to see you all there for some networking. Thank you again.